Imagine feeling like your thoughts are out of control, hearing voices that no one else hears, or experiencing unpredictable mood swings. What if I told you there's a medication that can help stabilize these symptoms? Meet Olanzapine, Zyprexa, a powerful atypical antipsychotic used to treat schizophrenia, bipolar disorder, and even depression. But how does it work? What are the risks? And is it really as effective as doctors say? Stay tuned, because today we break down everything you need to know about Olanzapine. Olanzapine, sold under the brand name Zyprexa and Olanzia, is an atypical antipsychotic primarily prescribed for severe mental health conditions. Unlike older antipsychotics, it works differently on neurotransmitters, reducing hallucinations, mood swings, and severe anxiety. But how does it actually work in the brain? Let's find out. Olanzapine targets dopamine, D2, and serotonin, 5-HT2A, receptors in the brain. Here's what happens. Dopamine blockade, D2 receptor antagonism. Too much dopamine activity in certain brain areas is linked to schizophrenia. Olanzapine blocks excess dopamine, reducing delusions and hallucinations. Serotonin modulation, 5-HT2A antagonism. Unlike older antipsychotics, Olanzapine also blocks serotonin receptors, which helps improve mood, reduce anxiety, and prevent movement-related side effects, EPS. Other neurotransmitter effects. It also affects histamine and adrenergic receptors, which explains why it can cause sedation and weight gain. FDA-approved uses. Schizophrenia. Reduces hallucinations, delusions, and disorganized thinking. Bipolar disorder, mania and maintenance treatment. Controls mood swings and prevents future episodes. Bipolar depression when combined with fluoxetine, for example, Symbyax. Off-label uses. Major depressive disorder, treatment-resistant depression. Generalized anxiety disorder in some cases. PTSD and borderline personality disorder in selected patients. However, not all off-label uses are recommended, as Olanzapine has significant side effects. Always consult a psychiatrist before considering it. Dosage and administration. Dosing is highly individualized, but here's a general guideline. For schizophrenia, the starting dose is 5 to 10 milligrams per day, with a target range of 10 to 20 milligrams daily and a maximum of 20 milligrams per day. For bipolar mania, treatment begins at 10 to 15 milligrams daily, aiming for 15 to 20 milligrams, with a maximum of 20 milligrams per day. For bipolar maintenance, the initial dose is 5 to 15 milligrams daily, targeting 10 to 20 milligrams, with a 20 milligrams per day maximum. For treatment-resistant depression when combined with fluoxetine, the starting dose is 5 to 12.5 milligrams daily, with a target range of 6 to 18 milligrams and a maximum of 18 milligrams per day. For elderly patients or those with liver disease, lower doses should be used. Side effects and precautions. Olanzapine is highly effective, but it comes with some significant side effects. Common side effects include weight gain and increased appetite, sedation and drowsiness, dizziness, fatigue, dry mouth, and constipation, mostly due to its strong antihistaminic and anticholinergic effects. More serious but less common risks include metabolic syndrome, which can lead to diabetes and high cholesterol, neuroleptic malignant syndrome, a rare but life-threatening reaction, tardive dyskinesia, causing involuntary movements, and in some cases, severe mood changes, including suicidal thoughts. These effects are primarily linked to dopamine and serotonin receptor blockade, which alters neurotransmitter balance in the brain. Pharmacokinetics and Metabolism, higher body processes. Olanzapine. Olanzapine is primarily metabolized in the liver by CYP1A2, producing inactive metabolites. It starts working within 1 to 2 hours, has a long half-life of around 30 hours, and is excreted mainly through urine and feces. Smokers may require higher doses because smoking induces CYP1A2, speeding up Olanzapine's breakdown. Before we wrap up, here are some fascinating facts about Olanzapine. It was initially developed for schizophrenia, but today, it's widely used for bipolar disorder and depression too. It's one of the most notorious drugs for weight gain. Patients can gain 5 to 10 kilograms within months. Studies suggest it has neuroprotective effects and may help in Alzheimer's and Parkinson's disease. Smokers metabolize olanzapine faster, requiring dose adjustments. Among antipsychotics, it's one of the worst for weight gain and metabolic issues. Increases risk of stroke and death in dementia-related psychosis. Now you know everything about olanzapine. If you found this video helpful, don't forget to like, share, and subscribe for more medical insights. What are your thoughts on olanzapine? Have you or someone you know used it? Let's discuss in the comments.